Hi, my name is Kimberly Strong, and I'm the primary faculty with the program in Genomics and Ethics at the Medical College of Wisconsin in the Center for Bioethics and Medical Humanities. I'm going to be talking today perhaps from a slightly different perspective than you might be used to or you might be experiencing through some of the other presentations, but I'm going to be talking about the different perspectives that people might be bringing to the ways that they might be looking at genome sequencing, particularly the ethical issues that get discussed quite frequently. And so I'm going to be hypothesizing in some ways that various groups of people might be considering this issue. As I go along, just a quick reminder that should you have questions that come up, feel free to write those in. However, I probably will leave them to the end to sort of address some of those. But a lot of the things that I'm going to be discussing, I'm hoping will generate some discussion or some questions along the way. So I'm just going to tell you a little bit about myself, and there's some reasons for that, but I'll get to that in a moment. So I have a bachelor's degree in biology with a minor in chemistry that I gained here in the United States, actually. And then after about a decade, I decided to go to grad school and did that overseas in Australia. So if you hear a slight accent, that's partly where that's come from. So I did qualifications in genetic counseling in Newcastle, Australia, and did my PhD in bioethics at the University of Sydney. Now, some things I'm pointing out as well is that I've had experience with two different types of health systems. So a public system that exists in the Australian context and the private system here in the United States, although there is a private system as well in Australia, kind of an additional system. My professional background includes some experience in genetics, in pre-implantation genetic diagnosis, embryology, genetic counseling, psychosocial research, matched unrelated blood and marrow transplant, in particular the search and the patient advocacy perspectives in that arena, policy development, and bioethics, of course, which is primarily what I'll be talking about today. And in particular, empirical bioethics, which I'll talk a little bit more about what empirical bioethics is, but in very, very short, empirical bioethics is using empirical kind of methods to explore ethically contentious or bioethical issues. Some things that I'm not, and I always kind of put this out as a little bit of a disclaimer, is that I'm not overly tech savvy. So my knowledge of genomics, for instance, in some of the ways in which the technology has moved forward, may be beyond certainly my understanding of genetics that I gained quite a long time ago. I'm also not a practicing clinician, so while I have qualifications in genetic counseling, I'm not seeing patients or families anymore, and I'm not a bioinformatician by any stretch of the imagination. I also don't claim to be a true philosopher, so I put that out as the disclaimer in case there are any philosophers watching at the moment. And really the list goes on, but there's a reason that I talk about that up front, and that's that I'm going to be proposing some things or some ways that groups of people might be looking at the ethical issues and the types of hopes around genome sequencing. And it's based on some of this previous experience that I have. But I would also suggest that anyone who's coming to their research is going to bring particular types of background, although I think being transparent about it is particularly important in various genres of research. I do qualitative research, so being reflective in this way is just an absolute requirement. But I wanted to put that out so that those of you watching can kind of consider how those backgrounds that I've just discussed might be playing a role and might be informing the types of things that I put forward. Some things I wanted to highlight at the beginning, I really should have named my talk variables that may impact the weightings given to genome sequencing issues. We know at the moment that data is limited, really. as to the ways that people are weighing the risks and the benefits around genome sequencing. We certainly can draw from experience that's been gained through genetic testing of single gene disorders and other microarray testing. But I think when it comes to genome sequencing and the vastness of that data, we're not entirely certain how people are weighing these things. So I'm making some suggestions around that. And really my aim is to kind of generate some discussion and possibly drive some areas of research, because we see a lot of commentary coming out around the ethical issues, particularly around the return of incidental findings or secondary findings and concerns about privacy, etc. I wanted to perhaps suggest that and encourage the types of research where we interact with the people who are on the front lines making those decisions. So the types of clinicians that are on the front line, as well as the types of patients and families that may be involved in the decision making. So there are many people that are talking through this conference opportunity that would have a vast amount of information about genome sequencing. I've put this slide in simply for those that may be watching only this broadcast and not others. So genome sequencing is really a process that's used to look at one's full DNA complement. So while we don't know what all of that complement means, we are able to look at the various base pairs that are basically the design for the body's makeup and processes. This genomic data, in speaking about the fact that it's responsible for the workings of the body, is very comprehensive. The comprehensiveness aids really in the types of questions that can be answered. But it can't actually answer all the questions, particularly since we're still learning about what that information may mean. But again, with the positive comes some of the negative, that the fact that this information is so comprehensive magnifies some of the potential for misuse or for areas of contention around privacy, and it challenges some of our current paradigms around de-identification, etc. So the complexity and the uncertainty around some of this genomic data also means that there's the possibility that the information could be misunderstood, that it could be seen as more determinative than it is known to be at this point in time, and that some of the multifactorial applications or implications may be downplayed in some ways. We know that this enormous amount of data generates the likelihood of incidental findings, or findings that we weren't expecting, or findings that might be secondary to what one was initially going in looking for. And that this issue, even when we strip the information of the traditional types of identifiers that we would think would provide a protective nature around identifying research participants, particularly as some of this information is placed on public databases, it's requiring us to kind of rethink or to identify ways that this information might be unique because of the fact that it is in itself perhaps one of the most identifiable type of features to the individual. And it raises those questions about who should have access to the data and control that data because of this potential identifiability. So some of the uses of genome sequencing, it can be used in various contexts. I don't intend for this to be all-inclusive, but I am trying to touch on the majority of the types of uses. So it's been used in the research arena, although when we talk about the research arena, it does at times raise some different types of concerns around obligations to research participants and whether or not there's going to be potential benefit for the individual that's saying yes to particular types of research. And if there is an expectation of benefit, how long does that expectation last? We know that we're constantly learning more about the genome, and when there's new information found, does that require that researchers go back and re-examine that information? So some of these current paradigms that we're used to do require some additional thinking. From the clinical perspective, MCW has some experience around, or considerable experience around the issue of the clinical odyssey, or the diagnostic odyssey, whereby an individual or a family has been trying to find out what the cause of particular symptoms are, and genome sequencing was utilized in order to help guide that diagnosis. Of course, there are other potential clinical uses around personalized medicine. A lot is discussed in the realm of cancer genetics, cancer genomics, the tumor, what type of genetics are existing within the tumor type, pharmacogenomics, if there's certain types of drugs that would be better or metabolized differently for different individuals, and or different individuals and their disease could be treated better with different drugs. So that's certainly a promising area. And looking at wellness planning, I'll place a question mark after that, because wellness planning is in some ways controversial, partly because we know that just based on family history, we know that we're at increased risk of various things, and from a population level, some individuals are better than others at making lifestyle changes that would impact and reduce potentially their risk for various things. So, so that's the reason for the question mark there. We also know that private individuals can sometimes be interested in pursuing direct-to-consumer. So we've seen that that take place as well, and uptake of that. So from a clinical perspective, the literature tends to focus on the points that here around predictive capacity. So there certainly is concern that the genotype-phenotype correlation is not always one-to-one. It's not always direct. There's often multiple things, multi-factors that are at play, including environmental things. So there are some genetic variations that we know if a particular variation is found, that it will lead to a particular phenotypic expression or physical expression in that individual. But for the most part, there's some variation around that we aren't entirely certain what particular genotypes might lead to particular phenotypes with exact predictability. We also know that the knowledge base is changing rapidly. So as more people have genetic results available and looked at, we know that at times what looked to be a predictive gene variant or genetic variation may later prove not to be terribly predictive, or vice versa. So there's some of that gets talked about in the literature, the issue around informed consent, the challenge to our current paradigm around the autonomous decision maker in front of you, and that a decision is made or that a consent form is signed at one moment in time. Now, this isn't the only arena in which it's been proposed that consent is an ongoing process, but I would propose that, along with others in the literature, that there is something a bit unique here, particularly around genetics, because it may be possible that a revelation is made about another genetic relative's health status just based on the individual who's decided to pursue testing themselves, and the return of results around incidental findings. It's extremely time-consuming to walk through the types of findings that may be revealed, and I think that there are teams of people that are working diligently on trying to find the best model of informed consent for genome sequencing going forward. So I applaud those efforts. This therapeutic misconception possibility around the research that's taking place that I've mentioned previously, where there's an expectation of personal benefit in participating in genome sequencing research. And then again, the identifiability or the potential identifiability of research participants. From an ethical perspective, there are the issues around privacy and to lead to some concerns about discrimination. Now we know that the Genetic Information Non-Discrimination Act does protect from some of those areas of concern, particularly in the healthcare setting, but even in the healthcare setting, there are exceptions to the rule. So for individuals seeking health insurance or organizations or companies that are of below 15 employees are excluded, as well as life and long-term disability, long-term care and disability insurance are excluded. There may be very legitimate reasons for their exclusion, but these are some of the ethical issues that are some of the exclusions to that legislation. With regard to the incidental and secondary findings, there's issues around what actionable means to different people. So actionable in the traditional sense would be that there's some sort of treatment or screening at the very least that could occur in order to reduce someone's risk for various things or to treat a various condition. Actionable to other individuals might mean that they're able to make different life decisions based on some of the knowledge. If they knew that they were at a significantly increased risk of perhaps an earlier death, or a condition that might impact their cognitive ability, they may make different life decisions. And for them, they think that being able to have that bit of insight is an actionable, is something that they find beneficial because of that actionability. As well, the uncertainty of the findings is a concern that's brought up quite a bit around incidental, and what do you do with findings that are where there's an uncertainty around them, and whether those findings should be revealed to various individuals. There's the impact of those genetic findings, particularly of the uncertainty on the individual, so some potential psychosocial impact, both on the person who's had the genetic testing done, as well as others who are biologically or genetically related to that individual. Once you know something, you can't unknow it, and so there's talk about one's right not to know if they are at an increased risk. Some people would want to know and others would not, and that may not be consistent through various families. In fact, we know that it's often not consistent based on other genetic testing arenas that have shown this in the past. And there's the concept of the right to the open future. So when we're talking about children, there's the idea that perhaps a child would be treated differently if they were known to be at a predispositional risk to an adult onset condition, and the fact that they may grow up to be the type of person who wouldn't have wanted to know that information. In addition, we've got the issue that comes up around the potential infrastructure inadequacies. So at the moment, are clinicians currently ready to deal with people bringing their genome sequencing to them? And I think lots of suggestions have been that we're not entirely ready yet, and how best to prepare for that may not be overly straightforward. And that other support networks and other ways of managing patients may be needed. So there's some efforts going on around certainly looking at ways that people can interact with their genome through some of the direct-to-consumer sites and measuring some of that. So that may be informative as we move forward. So the bulk of what I'm going to talk about today, or at least I'm going to put suggestions forward, is really in this concept. We talk about these things, often these ethical issues, as if, and the benefits, as if they're sort of equally weighed across the spectrum. When in fact we know that decision making, that the risk, the benefits, the values that are at stake for different individuals in making decisions, that it's not a one-size-fits-all, that in fact people are going to weight things differently depending on what their personal experience of illness might be, or those around them, what their experience of illness has been. And so with some of that in mind, I'm just going to go through a few things and put forward some of my ideas as to how people might be motivated or looking at benefits and the risks associated with genome sequencing. So when it comes to some of the motivations, if you've got a seemingly healthy individual, or at least one who perceives themselves as healthy and they don't think that they've got any kind of chronic thing, they don't tend to take much in the way of medications or any of those sort of things, they might be motivated to look at potentially genome sequencing for curiosity purposes. It might be that they've got a curiosity around their ancestral origin, but they're not really that concerned, or in some cases that interested in some of the other genetic information that they might find out, or they're assuming that there won't be much of interest in their genome anyway because they themselves feel quite healthy. However, others might be hoping to identify some actionable type genetic predispositions so that whilst they're healthy at the moment, they would hope to change or to ensure that they remain that way by making some lifestyle changes or increasing their screening rates for various conditions because of a known now increased risk for various conditions. They might also want to learn about other types of genetic things like a carrier status, so to know that they themselves, although they're not having any problem with a various condition, they do have a genetic variation that puts them or their family at an increased risk. Or if they're planning, so around reproductive planning, that might be another reason or motivation for doing some of the genetic tests or genome sequencing. And others may not actually themselves want that information, but they are interested perhaps in contributing to just general scientific advancement, and they've read about the fact that the best way to improve information or knowledge about the genome is to have more people's genome data combined in public databases. From a risk perspective, there are those issues that I've already discussed around loss of privacy, potential impact on insurability, impact of their info on others and the others' right not to know about something, the fact that there is still a lot of uncertainty around many of the findings of the genome, and the potential psychological impact. Some people might think that they'll cope quite well with finding out that they're at a significant increased risk for some condition, but turn out that they actually don't quite cope as well as they thought they might. So those are some of the things that they might be thinking about, and those risks might outweigh their general curiosity or the other sorts of things because they're in a general healthy kind of predisposition. I've put a child on this picture as well because I think some of these things, when we talk about children, particularly as they're first born, many children are presumed to be quite healthy in that state, and thankfully so. And so it might, the motivations that parents have for these various, for genome sequencing at the young age of their child might be for these very same reasons. But I do think it raises some different questions. And I'm not going to go into great detail again because of the fact that we're talking about, we're making an assumption around a seemingly healthy child. Now, next we'll just talk about a person with a strong family history of illness. So some of the motivation for someone in that case is that we know that some people who have witnessed family members who've gone through serious illness, they themselves sometimes make assumptions that, well, that's my genetic relative. They assume that they will, in fact, follow the same course. They assume that they will die of heart disease as their father did, or perhaps assume that they will get Alzheimer's as their family member has as well. So it might be that they're motivated to go through this because they think they've got this uncertainty, they're making assumptions about things, and they're hoping that it may either reduce some of that uncertainty, perhaps alleviate some of their fears, or in fact confirm some of their fears. Some people feel better knowing the answer than not knowing an answer. So when it comes to some of the risks, I think privacy is still certainly a risk, but others may make assumptions already regarding that person's risk. So it might be that others are making assumptions that someone's at an increased risk of heart disease because they know that their family members are at risk of that. The same goes for insurability. We know that family history is typically the way that that people look at insurance. If you're looking at some of the insurance rates that individuals will have, will be influenced by their family history of illness. We also know that family history, of course, is utilized by our health professionals to try and provide some insight into the increased risk that some people may be of various types of conditions that they could do something, lifestyle changes around. The secondary findings are still an issue for someone with a strong family history of illness, of course. And it's perhaps the strongest one that might outweigh the fact that they want to provide some uncertainty or provide some information that might alleviate some of their uncertainty. Those secondary findings might be that they're assuming that everything other than the things they're currently worried about are fine, and they find out actually there are some other predispositional things. And that psychological impact of learning about some of those may be significant for various people. We know that different personalities are people who are information seekers, in which case the more they learn, the less anxious they become, even if some of that information would in itself be potentially anxiety-provoking. There are others that the more information they have and the more uncertainty they're dealing with, the more anxious they become. So again, we're dealing with the fact that there are going to be spectrums of people, and the way they handle this information is going to be different. And again, the impact on others as well that may not want to know in the family. So a person who's experienced a chronic illness, now they themselves have already experienced, have some illness experience, and so it may be that they're hoping for what they're weighting most heavily is the potential for pharmacogenomics to give them some better indication of medications that they could utilize, or different tailored treatment options, hope for a cure even, with there being more knowledge about the disease that they are battling with. Now, when it comes to the risks, we're in the same situation where they're very similar to the previous, but in fact the weightings may be significantly more towards the benefit because they themselves are in a situation of a chronic illness, and that might be so burdensome to them that they're willing to take on some of those other risks that they see as potential risks as opposed to the actual experience they're currently going through. So next I'll talk about a person who's been diagnosed with a life-threatening condition. So it might be that the person previously had seen themselves as someone who was quite healthy and didn't have an issue, and then they're diagnosed with cancer. And so in some cases it may be that cancer diagnosis means that all bets are sort of off when it comes to some of the risks, that what is most important, what is most salient to them at this moment is learning as much as they can about treatment options and the way that their tumor might respond to different medications, and that their perspective is completely changed by this diagnosis. We saw this in some ways with embryonic stem cell research, whereby individuals who might held quite strongly to whether that type of research or treatment pathway was something that was a viable one from an ethical standpoint, to when they had a family member or them themselves diagnosed with a condition that may have seen some benefit from that type of research, or someone with a spinal cord injury, there was some shift in whether they found that to be ethically acceptable or not. And next, I'm going to talk from a similar perspective around a life-threatening illness of a sick child or a chronic illness of a sick child, and being a parent in that case. So we know that some of these things can be quite transformative for people. So in a study that I was involved in previously with colleagues at the University of Sydney, we looked at an ethically contentious topic around the use of pre-implantation genetic diagnosis for an HLA-matched sibling or a savior sibling. In this context, it may be that, or in this context, what we did was discuss with both the professionals and parents that were in the midst of conversations or may have been in a situation of having conversations about this potential treatment option, as to what they thought about the clinical and the ethical implications of that. And from the professional standpoint, they tended not to talk about this as something for parents to consider, mostly given the types of ethical arguments that were put forward in the literature around commodification of children and children experiencing risks without personal benefit themselves. Interestingly, though, the parents consistently reported wanting to know about therapeutic options and overwhelmingly dismissing some of those arguments that were so prevalent in the literature and were repeated by some of the clinicians, and against whether or not parents should have another child under these types of circumstances. And in fact, some of the parents talked about the fact that they might worry about those things when they're not in the situation or having had the experience of potentially losing their child, because they didn't have the luxury of considering some of those other things. So that may be the same case when it comes to genome sequencing, where they might, if they are in a position, not in a position where their child is currently at risk of serious health condition or death, they might be interested in discussing some of those other ethical issues. But in the primary one, what they're interested in are some of the genetic findings. And so they're weighting towards the benefit of genome sequencing, I think is quite understandable and not overly surprising. From a philosophical lens, maybe some of the things that may be driving this are around formative experience. So the fact they've had the formative experience of individuals having the formative experience of an illness themselves or in their child. The idea around regret theory, whereas they've tried everything, they've looked at all avenues to try and treat or understand a condition, that there are more things going on than just the individual. So the idea around relational autonomy, and the fact that there are changing perspectives that go on. So even with clinicians in the study that I was talking about, their perspectives tended to change when they were talking from a professional standpoint, as opposed to speaking from a standpoint of a parent. So when they started talking about what their expectations and what their thoughts were around treatment options for their own child, there tended to be a shifting in position. And it showed really some intuitive decision-making as opposed to some of the analytic decision-making that we've seen previously. And driving some of this was the moral valorization, or what I've suggested and my colleagues suggested was the moral valorization of children, whereby that the survival of that child was put above some of the other, what were phrased by some of the participants in my study as kind of the academic or the ivory tower discussions, that was fine to discuss in those academic settings, but from their real world perspective, they were things that held far less weight in their decision making. Now, the value of the empirical in this type of context is that we saw in the literature lots of ethical arguments that are lots of ethical concerns being raised. And while those concerns may be quite valid, and I wouldn't argue otherwise, I do think there's a value in utilizing empirical from those on the front lines, from those who are in the midst of the decision making, and the usefulness of that, that it could provide really a description of those opinions and reasoning patterns that are influencing decision making, and that can help inform some of the consent process that's going on. The data that's generated may challenge the current convention of the way that we view the ethical concerns that are being put forward in the context of genome sequencing. It may be that quite a few people are okay with the risk involved in the potential loss of privacy, and so from that perspective, we'd be willing to take on those risks with the potential for there to be the benefit that they see as far more relevant. And it may show this shift in position that hadn't been evident previously. So what I'm suggesting is that perspective matters, and I don't think that I'll be the first to say this, but I think that it's a good reminder in the case of genome sequencing that while there are risks and there are potential benefits or motivations for people wanting to pursue this, it's not going to be the same for everyone, and that there are some very powerful drivers behind whether or not somebody may decide to take up genome sequencing and what information they may want returned to them in that context. So empirical bioethics really can reveal some of these stark contrasts between what we discuss in our academic worlds and what the patients and families and clinicians are contemplating in their what I'll call real-world perspective. Also may reveal some real differences between scientific and medical research and the way that patients and families experience medicine overall. And between decision-making in the abstract, so when I'm sitting and I'm thinking about the ways and the risks and the ethical concerns that might be generated by a particular emerging technology, that may be vastly different in the decision-making context for those that are dealing with life-threatening and illness experience perspectives. Again, I'm not suggesting that that's entirely new, but I'm putting this forward as a reminder for us to think about this in the context of genome sequencing. I would also like to say that I'm not suggesting that the empirical can tell us how we ought to behave, but instead, I think that empirical data can provide some guidance and inform the ways that we ought to move forward with various things, because they do take on the perspectives of those, and they can sometimes shape the communities from which those ought-type statements are being generated. So I put forward this question, what is on your radar? I would suggest that a lot of things become relevant when they become part of your radar. So I'm using this as an example. We've got a lot of things coming at us, and so we filter, and we don't think about, we may not have on our radar things such as childhood leukemia until we have a neighbor child who's diagnosed, or until we have, heaven forbid, a child of our own diagnosed, or we ourselves are somehow directly impacted, or somehow a particular technology or treatment option or medication becomes part of your radar, part of your reality. And that in itself might change the way that you think about that topic, or that if it's a controversial treatment, whether or not you'd be willing to engage with that. I think in the abstract, we're not always terribly accurate in trying to predict how we would behave when a situation presents itself. So I pose these sorts of questions. Of course, I'm not expecting anyone to answer me on this, but when people pose these questions, I would suggest that that we think about whether or not there are limits on the information that someone would want to know, that you would want to know, or that you would want others to know about you. So are there things that you would want to learn if you said yes regarding having your genome sequenced? whereas you wouldn't want that shared with others, or you'd want to really control how that information was shared with others. And then from the perspective, if you have children, would you want your child's complete genome sequenced? And if so, the same sorts of questions. What information would you want to know? Do you think there are particular things that should be that should not be revealed based on the fact that that it's a child's genome that's being tested or that's being sequenced? And again, what you'd want others to know about that child's genome sequencing. So what I'm suggesting here is that not everything is polar opposites. So just because we've got somebody who is a real enthusiast of new technologies doesn't mean that that they're going to take up every technology just because it exists. So it's a cartoon I like to on the one spectrum, and neither is it from the other perspective, where someone who thinks that genome sequencing is a step too far, that it's too early to be doing these sorts of things. It's not necessarily that they are someone who dismisses or is not interested in any technologies, but it might be that there's some place along the way that they haven't reached yet, or questions that haven't been answered yet that they feel need to be answered. So with that in mind, I'm coming to the part of my talk where hopefully there'll be some questions or some points of discussion that might be able to be had. Again, I'm with the program in Genomics and Ethics, and these are some of my colleagues that I'm working with currently, and we're trying to take up the question, the empirical question in particular, of some of these issues, how people are managing the kind of difficult consent process, as opposed to the one-time off, and looking at return of incidental findings and attitudes towards that. We've got funding, currently we receive funding from the Advancing a Healthier Wisconsin Research and Education Fund to really fill the gap between those, the clinical practice and some of the ethical, legal, and social implications of genomic sequencing, and we work closely with our clinical and lab colleagues in trying to look through some of these questions. Our department has expertise in multiple areas there that you can see around the ELC issues: philosophy, empirical bioethics, communication, the community engagement, which is something that I think is going to be vital in ensuring that various communities have a voice in policy decisions as we move forward in decisions around genome sequencing, return of results, policy, perhaps further legislation, or maybe we've gone far enough with some of that. That'll be decisions.
Could you make sure your sound button up in the top right is muted? That way you don't get any feedback on your interview.
Yep, I'm muted at the moment. Oops, there we go. There we go. Do we have a question there?
Okay. And then let's hold right there because your audio and video is delayed. Press the sound button, mute it, and then I'll be back on in about 2 minutes, and then we'll go through the rest of the process before we start you up.
Sorry, you've just come through online. Sorry about that. So at any rate, I'll go in here. If anyone has any questions, I would appreciate any coming through. Looks like there are none at the moment. I apologize for that that break in there. So I think if I don't have any questions that are coming through, I may just leave everyone with some thoughts really around around potential avenues for exploration. I think that research with various communities, I'll reiterate, that is something that is going to be vital going forward. Understanding the experience of the early uptake, people who have begun the early uptake of genome sequencing. I think there's a lot that can be gained from learning how they've responded and how they've dealt with some of the return of results in particular in their decision-making process. I think there are things to be learned from those families that have gone through the clinical odyssey or diagnostic odyssey, so there are going to be avenues in that. And as well as those who want to move forward in various arenas but may not themselves be interested in return of the results at this time. So going to want to ensure that that we gain a variety of perspectives in going forward with this, to ensure that the promise of genome sequencing is really felt by those as many as possible. So from there, I may go ahead and just remind you of the continuing education credits. As you can see, there's a link if you are looking to obtain those credits. So I've come to the end of my talk here. Thank you.